Hello, my name's Helen Cullington. I'm a clinician on the University of Southampton Auditory Implant Service, and I want to tell you today about a trial that I'm doing to introduce some remote care to adults using cochlear implants. So, thinking about how telehealth is changing the support we provide for deaf people, there's a lot of change going on in the world at the moment, so let's have a look at that first. So as of last year, almost all adults in the UK were using the internet, and this represents, of course, a massive increase in the last few years and really opens up some possibilities for adults to be able to do some of their healthcare online. Thinking about mobile phones, mobile technology, almost everybody in the world now has access to a mobile phone, and mobile phones are thought to be rivaling penicillin in the impact they're having on global healthcare. We've just got to the point now that the number of mobile phone subscriptions worldwide is more than the world's population. So that is a massive change that mobile technology has introduced. But why does this have anything to do with cochlear implants? Well, thinking about the UK situation, there's 14,000 people in the UK currently using cochlear implants, 600,000 worldwide, and each year in the UK, 1,200 new people receive a cochlear implant. So the numbers of cochlear implant users are increasing, of course, every year. But why can't we just keep the service the same? Things are fine at the moment. Why can't we just carry on exactly as we are? Well, several reasons really. That number one being the vastly increasing patient numbers. So in 2014, I don't have the 2015 figures, I'm afraid, 53,000 cochlear implant surgeries took place worldwide, and the figures have shown that the number of surgeries quadrupled in a 10-year period. So a massive increase in the number of cochlear implant surgeries happening. But of course, we are expecting even more changes to happen. So the UK population and worldwide population is ageing. So, and actually the number of pensioners is going to increase by nearly a third in the next 20 years. So we might well expect a lot more hearing impaired people. And actually in the UK, we're still not implanting the vast majority of people who could benefit from a cochlear implant. So if we can manage to increase referrals, increase awareness, we may see an even steeper rise in the number of people with cochlear implants. Now, thinking about funding in the NHS, I don't think that the amount of funding is going to quadruple in a 10-year period. So we have the choice. Do we treat the same number of patients with the same level of service, or do we treat many more patients with a streamlined, optimized service? And I know what I would prefer. I just want more people to hear with implants if that's what they want. So I would definitely prefer to optimize the service. Thinking about patient preference, patients are now telling us that they want to take more control of their cochlear implant at home. They want to be able to do some remote mapping. They want to be able to do some checks themselves at home to check their implant is working. They want online communication with their cochlear implant centre rather than a 2-hour drive maybe back and forth to their centre. And just thinking about my centre in Southampton, this shows Southampton on the map, this is where our patients live. So a lot of them are travelling for much more than 2 hours for their appointment. So if we can cut down this travel time, make things easier for them, that's going to be an advantage. And the current care pathway for cochlear implants is not patient-centred. And what I mean by that is most cochlear implant centres will see a patient on a routine schedule, so maybe at 1 year, 2 years, 3 years, 5 years. But what we need to be able to do is centre that more on the person using the cochlear implant, so see them when they need to be seen. So it might be when something has gone wrong, they need our help. It might be their hearing changes. It might be they have a new job and they need to use the phone, that's when we need to see the patients to give them help. So what am I doing about this? Well, currently I'm doing a project to introduce some remote care to adults with cochlear implants in the UK. And I have quite a diverse project team. I'm collaborating with the University of Nottingham. I have a change management professor looking at how this change in service affects staff, a computer scientist, a cochlear implant user, and a cochlear implant manufacturer. So what we're doing is introducing 3 aspects of remote care. 1, remote and self-monitoring. 2, self-adjustment of device. And 3, an online support tool. So let's have a look at these 3 aspects in a bit more detail. Number 1, remote and self-monitoring. A lot of patients have told us that what they want to be able to do is check their hearing at home, check whether it's okay, or see if they need to make some changes. So we've introduced a speech perception check that adults can do themselves at home, and also a long-term follow-up questionnaire. So looking at other aspects, do they feel they're hearing okay? Has anybody told them that their hearing has changed? Do they need help with any aspects of their care? The speech recognition test we're using is the digit triplet test, where the participants listen to 3 numbers in background noise and they have to type in the numbers that they hear. Here's an example of the test.
Digits 614. Digits 164. Digits 586. Digits.
So the people on my project are doing that on an iPad, doing it when they're out and about, doing it at home or on a computer. Number 2, self-adjustment of device. So again, we've had feedback from people using cochlear implants that it's all very well to set their map when they're in a sound-treated booth in the cochlear implant centre, but actually what they want to be able to do is personalise that map for their own real-world environment. Not many people live in a sound-treated room. They want to be able to make adjustments on the go to suit wherever they are. This is only available to people using Cochlear devices at the moment, but they've been given a customised remote control. Well, their own remote control has been customised so that they can do some of their own fine-tuning themselves at home. Another aspect we're doing is if a patient needs an upgraded sound processor, so generally this happens about every 5 years in the UK, instead of having the patient come into the centre, we are sending the processor pre-programmed for the patient to their home, including some links to videos, some tools to help them learn to use the new processor. And then if they need to, they can come to the clinic for a follow-up appointment in a few weeks. And at least by that time, they know what they like about the processor, what they don't like about it, what they can do and what they can't do. And I'm thinking about it a bit like an iPhone upgrade. So when I get a new iPhone, it is packaged up, sent to me at home. I look at the instructions, watch a few YouTube videos, try and figure it out myself. And then if I can't do it, I will then go to the Apple Store or whatever to get the help that I need. The third aspect is an online support tool. So what we've tried to do here is think about all the other needs that people with cochlear implants have. So what are the other reasons they visit the Cochlear Implant Centre? And we've tried to give them these tools in a personalised support package. So they have access to self-rehabilitation, working on music, setting some goals for their own listening. They can have reminders either by email or by text message for things they need to do to maintain their device, for example, changing the microphone covers, troubleshooting, equipment advice, and here's a few screens that come up for the patients. So they can also test their hearing through the online support tool, and then it will give them feedback about whether their result is worse or the same, and whether they need to do anything about it. Looking at the rehab section, they can set some goals for themselves to work on. Maybe it'll be something like wearing the speech processor more or using the telephone, and then they can go through some rehab themselves in the support tool. Also, of course, equipment needs. Patients might need replacement equipment, they might need help with their equipment, order a holiday loaner. This can all be done through the online support tool. So what are the benefits to the patient of this? We are trying to centre it on the patient. So what are the advantages? Well, less travel time, expense, disruption. If patients are travelling a couple of hours to get to us, then that can mean a day off work, it can mean additional childcare. And we've had feedback that some deaf people don't feel confident to travel a long way by themselves. So it may even mean a day off work for somebody to come with them. So what we're trying to do is have appointments only when they are needed. So no more routine appointments. Another advantage, increased confidence and empowerment to manage their own hearing health. So there's a lot of research that people with a long-term condition, the more empowered they are to take care of the condition themselves, the better their long-term outcomes will be. And then finally, it might mean more stable hearing. So if participants can test their hearing at home and troubleshoot their device, work out if they need help with something, it might mean that they can take action quicker if something has gone wrong. How are we assessing this? Well, it's a randomised controlled trial. I have 60 adults taking part, and 30 of them are on the remote care pathway, 30 people are on the standard care pathway. What we're trying to do throughout the project is incorporate feedback from all the stakeholders involved in the cochlear implant process. So we're collecting a lot of feedback from patients about what they like, what they don't like. We're also doing an assessment of the clinician's experience of remote care. So if we move to a system where patients are only seen when they need to be seen rather than routine checking appointments, this will represent quite a change to clinicians as well. So we're doing some interviews to assess what that means to them. And of course, we're liaising with commissioners who fund the cochlear implant service. Outcomes we'll measure in the project. The main one is patient empowerment, but we're also, of course, looking at clinician and patient preference, speech perception. We want to be sure that people on the remote care pathway don't end up with worse hearing, and use of clinic resources. People who are taking care of their own needs, do they end up contacting the clinic more, contacting the clinic less? Thinking about patient empowerment, we've done some focus groups to try and work out what it means to be an empowered cochlear implant user. And this is something that's really supported by the NHS at the moment, harnessing the renewable energy represented by patients. So empowering people to take care of their own health has a lot of long-term benefits. So when is all this going on? Well, right now I have 30 people using the remote care pathway, 19 women and 11 men, quite a wide age range, ranged from 20 to 83 years old, with an average of 64. And the people on remote care, their return mileage to their cochlear implant centre is between 10 and 312 miles, with an average of 90 miles. So it's quite a sizable journey for people to get to their cochlear implant centre. We've got a reasonable spread of devices represented in the remote care people. 4 are using advanced bionics, 12 Cochlear, 13 Medel, and 1 Neuralec. So the project is going on at the moment, and then people will come back in the summer and we'll measure the outcomes again. So ask me more about the results of the project later on in the year. Thank you so much for your attention.